Hi, I'm Dr. Bill Owens, practicing chiropractor in Buffalo, New York. Today, I want to take you through a case in which I used SpineCAMP as a decision support tool for my diagnosis. So let me share my screen real quick and we'll get to this case. I think you're going to find this pretty interesting. There's a lot of moving parts, and I will give some background on this case. This is a case of a 48-year-old patient that was actually in the back of a limousine while on vacation. The limousine had stopped suddenly, and he slid and flew across the back of the limo and hit his head and neck. He came to the office with a prior low back surgery, which wasn't really his area of complaint. The focus really was on the neck. So when we look at the SpineCAMP decision support tool, what this is really designed to do is help me to understand mechanically where his problem is or problems that he may have had in the past. Now, this is the neutral lateral x-ray. And then what we do is what I did is we took him through flexion, and we also took him through extension maneuvers. So the focus of today's case is not so much on going vertebra by vertebra for all the pathology that's present. You're going to see things on here that I'm not going to mention. What I want to showcase to you is how the SpineCAMP software helps me to look at how the patient moves. And this can be done without the expense, and it can be done without the complexity of fluoroscopy. So if we go neutral to flexion and then to extension, we're able to look at every single one of these vertebrae. So if we take the now digitized x-rays, and this literally takes about 60 seconds. And we do have tutorials on how that is done, but essentially this plot gets produced before I even complete the patient note. It's that quick. So if you look at all these magenta dots on here, these are going to be the corners of the vertebrae, and that's what's going to give us our geometry. What I'm able to do is actually take this geometry and pause a certain part of the spine. And now I'm going to be able to work through and move C2 on C3. So if I zoom in here a little bit and we look, what we're able to actually see is how these vertebrae move amongst each other. And I'm able to go through each level, and I'm able to examine what's happening. Now, you might start to see things as a trained, spine clinician that are interesting to you, right? We can see how C4 and C3 move. And what this starts to do is it starts to help me to hone in on the level that the lesion is actually occurring at. Now, one of the things that's even more important on this diagram here is this circle. And this is the center of rotation. Essentially, if for today's point of discussion, as long as the orange dot is in the green circle, everything is within normal limits. We will have multiple tutorials on center of rotation, but for today, I just want to talk to you about this patient. And we can go through each level, and we can see where we think the pathology may or may not be. But ultimately, his center of rotation is all pretty good. Now, when we take a look at the report, this is where it sort of gets interesting. And what's really nice and what I like about this as a decision support tool is when I'm in a hurry and I don't have a lot of time to go through everything that I just showed you, SpineCAMP will actually highlight in red the areas of the spine that are beyond AMA limitations, right? So anything that is an AOMSI threshold or greater will be flagged in red. And in this case, we see that the movement of C3 on C4 was flagged as excessive motion. So according to the AMA guides, there is an alteration of motion segment integrity in this case, and that is related to angular motion differences. So the difference of C3 moving on C4 compared to 4 on 5 and 2 on 3 is where the lesion is. If we go back and we look at C3 on C4, essentially we can see where that problem is. This was the result, or this was the reason for his headaches, This is the reason for his treatment and stabilization. And ultimately, this is what I'm conveying to the personal injury attorney to help them understand that this ligament injury is significant. We don't know if it's permanent yet because he's still under a course of care. But without this tool, my decision process wouldn't be as robust and it wouldn't be as specific. So when you're looking at these reports, just finally here, it's the red that make the difference, and it makes it essentially turnkey for you and your practice. Thank you. Have a great day.